Hi guys, so this is chapter 18, the beginning of it actually, 18-1. This is the musculoskeletal system, but we're going to talk about them bones. So the musculoskeletal system, what does it do? It provides movement. It includes the skeleton, all your joints, ligaments, muscles, tendons, etc. It provides a framework for your body, and the muscles help the bones move, and it works in concert with all your other systems like your nervous system and your cardiovascular system. Bones do a lot more than what you think. So they do support the body. They give shape to the body. They protect your vital organs and soft tissues. They have calcium in them, so they can give calcium back to the bloodstream if necessary, and phosphorus. They help us walk and move. And another important function is hematopoiesis. So all of our red blood cells, white blood cells, and platelets are made in our bone marrow. So fun fact. So the skeletal system consists of bones and cartilage, and then there's the articular system, which is joints and ligaments, and they all work together to provide movement. We already talked about what the functions are. So let's start with the little man and his head. So parietal, the parietal are at the top and the sides of the head. You have an occipital, which is at the back of your head, the base of your head. You have a frontal, which is your forehead, right? Roof of your skull, your nasal cavities. And you have two temporal bones, which are basically on either side, right? That's where your ear cavities are and your mastoid process. If you put your finger right behind your ear, there's a bone there. That's the mastoid process. And then your face, you have your lacrimal or orbitals, which are your eye sockets, the front part. Your zygomatic bone, which is the cheekbone, right? Your palate, which is the palatines, the back of the hard palate. Your upper jaw and the front of your hard palate is your maxillae. And then you have your mandible, and that's the jaw. That's the only one that moves. Mine moves a lot. All right. Right in here, I just want to talk real quick before we get to spine about some spinal deformities that you need to know about. And you must know these guys, okay? You have lordosis. Lordosis is, I call it the duck butt. That's the way I remember it. It's the duck butt. So if you ever see a pregnant woman, like when she's very pregnant and she kind of leans back and the butt sticks out to counteract the weight, that's lordosis, only they're not pregnant. It's an abnormal curvature of the spine. And if you look at the picture, you'll see that the bottom of the spine is curved almost excessively. Okay. So where their butt is kind of pronounced. Kyphosis, I just think of the Hunchback of Notre Dame. That's the one where they're leaned over. Scoliosis is an abnormal lateral curvature of the spine. So when you're looking at someone directly from behind, that spine should be straight up and down. If you look in that picture, it's kind of got an S curve, a lateral S curve. Also, another way to assess for scoliosis is have the patient bend forward and look at their shoulders. Shoulders should be even. If one shoulder's higher than the other, scoliosis. And that you need to know. Okay, there's our dancing skeleton on the next slide. Bones that you need to know. You really should know the major bones. You should know the femur, which is the thigh bone. You should know the two lower leg bones, which are the tibia and fibula. You should know that the patella is the knee, right? You should know that your toes are tarsals, metatarsals, and then the tippy tips are phalanges. Your hands are carpals, metacarpals, and phalanges, okay? You should know that your upper arm is your humerus, because that's your funny bone. Get it? It's humerus. Ba-dum-tsh. You should know that your forearm has your ulnar and radius. You should know the sternum, which is dead center in the middle of your chest, and then all of your ribs that connect to it. You should know your clavicle, which is in front, and your scapula, which some people call the wing bone in back. You should know that there really isn't a hip, okay? There's a pelvic girdle, your pelvis, and your femur, the head and neck of the femur, articulate into the pelvic girdle for a ball and socket joint, which is your hip. So when somebody falls and breaks a hip, Really what they broke is either the head or neck of the femur, the greater trochanter is what it's called. So just so you know, and you should know those bones. And that's enough, I think. And you should know that your hip bone in front, that's the iliac crest, because that's the ilium, part of the pelvic girdle, where it crests, right? It's the one that you can feel. So we have 206 bones in our body. A baby has 300 because a lot of the baby's bones aren't fused yet. In order for them to get through the birth canal, they have to be mushy, moldable, pliable, right? So what kind of bones do we have? We have long bones. They're the big long bones, like the femur, right? They support the body. They act like levers and, you know, your arms, your legs. We have short bones, like your wrists and your ankles, right? They help with movement. Flat bones, the sternum, right? Shoulders and hips. And then we have irregular bones. You have 3 teeny tiny little bones in your ears. Yep. That are kind of groovy looking, right? Let's see, middle ear, the knee and the foot, the patella. That's a complex little system going on in the knee joint. Between the patella, how it articulates with the femur and the tib and fib below, and then all the tendons and ligaments that keep that all together and allow the knee to do what it does. Pretty amazing. Structure of bones. So compact bones are hard and dense, right? Spongy bones are smaller bones. Think about the spongy part of the bone that's not quite the bone marrow. Inside the cavity is where the marrow exists, and there's yellow marrow and there's red marrow. So we'll talk about where hematopoiesis, and you need to know hematopoiesis, right? The red marrow is where hematopoiesis takes place, right? If you're on medication, for example, like steroids, corticosteroids, chemotherapeutic drugs, anti-neoplastics, they suppress the bone marrow, which suppresses the bone marrow's ability to produce red blood cells, white blood cells, and platelets. So red blood cells grab onto heme and they become hemoglobin. They transport oxygen. White blood cells fight infection, right? And platelets assist with the blood's ability to clot. So if you're immunocompromised or your bone marrow is suppressed, you don't have enough platelets, you're going to be at risk for bleeding. You don't have enough red blood cells being made, you're going to be anemic. You don't have enough white blood cells being made, you're going to be immunosuppressed and at risk, like a cold could kill you. Okay? So very important to understand the marrow and the fact that it makes all those blood cells. If we go to the next slide, there's kind of like a side section view of the bone, shows you the inside of the bone. This is a long bone. So in a long bone, the main part of the bone is the diaphysis. And then you've got the epiphysis, the proximal epiphysis, which is closest to the torso. And then the distal epiphysis, which is farthest away. This is the femur, right? If you look where they sliced it so you can see the inside of it, you can see the growth lines. Sometimes little kids will complain, my legs hurt, my legs hurt. There is such a thing as growing pains that children can get. And it's from those plates, the growth plates growing, because kids grow at a rapid rate, right? And then you can see the spongy, the red marrow inside the bone. That's where the hematopoiesis takes place. And then the medullary cavity. So that's the inside of the bone. You don't need to know all that, but you do need to know that red marrow is where hematopoiesis takes place. Next, so we're looking basically at the pelvic girdle, right? So the ilium, the iliac crest, right? And you can see in this picture pretty well where the head and neck of the femur is articulating into the pelvic girdle. So that's the hip joint, and that's a ball and socket joint. When you look at the side view, you can see part of the spine, the coccyx. Those are the vertebrae that are fused together. It's like your tailbone. People call it the tailbone. Let's see. Do we want to go to joints? Yep, we're going to go to joints next. So there are, 3 different kinds of joints: synarthroses, amphiarthroses, and diarthroses. Synarthroses are like fixed joints, and I'm going to give you some examples in the slides that are coming up. Amphiarthroses are the cartilaginous joints, And the diathroses, which are the most common, are the synovial joints. They're joints that have kind of a capsulated area in them with synovial fluid. Think of synovial fluid like the oil in your car. It's like a lube, a lubricant. So it keeps the joint nice and lubricated so it can continue to move the way it moves, right? Synovial joints include your hinge joints, that's your knee, your elbow, ball and socket joints like your shoulder or your hip, pivot joints, gliding joints, cognoid joints, and saddle joints. And I'm going to show you a picture of each of them with examples, okay? So there's a hinge joint in the next slide. That's the femur, the tib and fib, and the patella. And it's like a hinge, right? Your knee is like a hinge on a door. Goes just that way. Ball and socket joints have the most ability for motion. They can kind of do, the shoulder, like I said earlier, is the best. It can go all sorts of ways, okay? But the hip's also a ball and socket joint. You have pivot joints. When you look at your upper arms, and I'm going to try to get this in the camera, look at your upper arms or your hand. There we go. We'll do that. Okay. See how it can turn, right? Supination. Okay. So that's the pivot joint. We also have next condyloid joints. And I think there's a picture of condyle. Did I not put one in? Here you go. If you go ahead to slide 22, there's each of the types of joints and then an example of each, right? So plain joints, like your vertebrae, okay? Hinge joints, like we talked about, your knees, your elbows, ball and socket, shoulders and hips. Saddle joint, which is in your fingers, metacarpals. Pivot joints, also in your arms and legs. And don't worry about ellipsoid joints. Ellipsoid joints would be right at the vertebra C1 where it hits the base of your skull, right? So think about what you can do with your head. Can you do this, right? And that's an ellipsoid joint. It allows that type of motion forward and backwards, right, with the neck. Okay, so I'm going to breeze ahead to cartilage, which is slide 24. Think about your nose. That's probably the best example of cartilage. The septum, which is what divides the nares, right? The right side of your nose from the left side of your nose, and the nares are the openings. That is cartilage. It's like bone, a little bit softer and more flexible than bone. And there's 3 types of cartilage: hyaline, fibrocartilage, and reticular cartilage. You don't need to know about those. Just understand that it's connective tissue that is like a bone, but softer, okay? Does a lot of things. It's a shock absorber in some parts of your body, helps reduce friction in some joints, and provides a surface for rotation. There's cartilage also here in that ellipsoid joint at the base of the neck. Question, the elbow is an example of which type of joint? If you said that was a hinge joint, you would be correct. All right, so now, this is a side view of the skull, and this is showing all of the suture lines. Think about a newborn infant and the soft spots, right? They're called fontanels. The reason that they're there is because the skull is not fused yet. So there are openings between the bones of the skull. That's why babies have 300, give or take, bones. We only have 206. When the baby goes through the birth canal, the head has to mold in order to fit through. Otherwise, we would crush their brain, right? And then once they're born, slowly over time, those fontanelles will close up and those bones will fuse together. So this is showing the suture lines of where those bones originally were not fused, but as adults now they're fused. You don't need to know all those suture lines, but it is interesting to look at them, okay? So the next picture shows the fontanelles when a baby is born. You have an anterior fontanelle and a posterior fontanelle, and then some gaps in between that you can see. Anterior lateral sphenoid fontanelle and the posterior occipital fontanelle. And they all those bones will fuse together over time. The anterior one takes about 3 to 6 months. Posterior one fuses up pretty quickly, 1 to 2 months. Next, we have your vertebral column, okay? So what you have is you have a spinal column, and inside of that is your spinal cord, and wrapped around it are the vertebrae. And they are there for lots of reasons, movement, but protection too. because to protect that spinal cord, because every nerve in your body emanates from your spinal cord. To remember how many vertebrae you have, cervical, thoracic, and lumbar, just remember breakfast, lunch, and dinner. You eat breakfast at 7 a.m., you eat lunch at noon, you eat dinner at 5, 7, 12, and 5. 7 cervical, 12 thoracic, and 5 lumbar. You also have vertebrae at the bottom, which is the coccyx, sacral coccyx, but they are fused together as one solid unit. That's your tailbone. Then if you look at the vertebrae, and this part is important. So the very top picture is looking down on a vertebrae, right? You can see that opening in the middle. That's where the spinal column and cord are, okay? And then on either side, it kind of looks like wings, right? They're kind of two little hook-looking things. That's where all of your nerves come from, your spinal column, from your cord, and emanate out the sides of the vertebrae and go to your body, everywhere in your body. In between each vertebrae, there's a pulpous bit of material called a disc. It's like a shock absorber, almost like a sponge kind of thing. If you hear somebody say, oh, I slipped a disc in my back, what that means is the vertebrae don't actually sit on top of each other. There's a gap, and in that gap is the disc, and the disc is like that shock absorber. Sometimes you can have an accident or move the wrong way or lift somebody the wrong way, and the way you move can push the disc so that it's no longer in place. It's pushed out from between the vertebrae where it's supposed to be. That's a problem for a couple reasons. One, because now there's no shock absorber between the bone. If the vertebrae hit each other, they're going to press on the nerves that are coming from the spine, and you're going to have pain and paresthesia. That's when you get pain that radiates maybe down your arm, if the damage is up here, or the famous one is down the leg, like sciatic pain, okay? So that is typically from bone hitting bone and compressing the nerves that go down the legs because that disc is damaged or slipped or herniated, okay? And it also creates a problem because over time, there can be more wear and tear because now there's no cushion between the vertebrae. And so they're, scraping against each other. They're not meant to be hitting like that. So if you have a herniation that's a complete herniation where that disc is just out and it happens, typically you need a surgical repair of that, right? Where they have to go in and like either fuse those vertebrae so that they're separated apart from each other so they're not banging on each other, because otherwise you're going to have a lot of pain and discomfort, okay? And nerve pain, which is very painful. And the next slide shows kind of even a more in-depth, a closer look. That's a lateral view, a side view of the vertebrae, the vertebral column. And that, you see the intervertebral disc, that gray stuff, that's the disc I was just talking about that can be displaced, okay? And then next slide is your rib cage. So your rib cage is important because it protects your heart and your lungs, right? And it allows for movement. You have what they call true ribs, which are the first ones up through number 7. Then you have your what they call false ribs, which are 8, 9, and 10. And 11 and 12 are floating ribs. Why? Because those last 2 ribs start at your spine, but they don't connect to anything in the front, right? They just kind of float back here, okay? Whereas the other ribs, if you look how they're connected to the manubrium or the sternum, right? The chest plate right in the center of your chest. Those last 2 ribs aren't really connected to the front. They're just kind of there. And then your hand. So when we look in the hand, you can see how the ulnar and radius, the 2 bones in the forearm, articulate with all these little tiny bones that are inside your hand that attach to the metacarpals, the carpals, and then the phalanges at the very tips. Carpal tunnel syndrome, think about it. It's carpals, right? Usually starts in here, and it usually comes from people that do repetitive actions. It can be very, very painful. And it's just from, overuse, repetitive use of the same sets of bones and muscles where they kind of get worn out. Physicians can do a carpal tunnel release, typically not the most successful surgery out there, but does work sometimes. Your lower extremities. So the top left picture shows you the hip, which is the greater trochanter of the femur, the head and neck of the femur going into the pelvic girdle. The picture on the right is your knee, where the femur and then your tib fib, the lower bones, articulate at the knee, and all the cartilage and the membrane that surrounds it, that keeps the synovial fluid inside, that keeps it lubricated. So when you bend your knee, it doesn't go like the Tin Man, right? And then your foot, where your distal and proximal phalanges and your tarsals and then metatarsals meet with the bones that make up your ankle, that articulate with the tibia and fibula of the lower leg, the malleolus, and the calcaneus, which is your heel bone. Fun story. I knew a guy that jumped off a roof and landed on his feet and broke every bone in both his feet and his tib fib in both legs. It was a hot mess. Yeah, because those little bones in there, when they break, it's usually that was a crushing break. And so hard. He had about 5 surgeries for that. So his name was Fried Mike. That says a lot. The pelvic girdle, that's your hips or your hip bones, and that supports your spinal column. It also protects parts of your digestive and reproductive and urinary system. The ilium, the ischium, the pubic bones, and the symphysis pubis. It's kind of like right where the pubic hair starts. That's that bone right there. They all form together to form the pelvic girdle, is what it's called. Okay. And reproductive, like I said, the organs are in there. It's protection and it's also support. If you found a skeleton on the street, you would be able to tell if it was a male or a female by looking at its pelvic girdle, because women have wider hips. We just do. We have babies and men don't. And then how is bone formed? So you need to know like an osteoblast. Those are the cells that actually form bone. So no osteoblast. Ossification is the formation of the bone when the osteoblasts all get together and make a bone. Bone growth really is affected by heredity. Your genetics really are a huge, huge part of how you grow, how you look, illness, wellness, just your state of health in general. But you can also go against your genetics by taking better care of yourself, by exercising and trying to eat relatively well, and so on and so forth. But for some people are prone to osteoporosis. Some people have less muscle mass than others. And I will say this, and it might not be politically correct, but men do have more muscle mass than women. It's the way they're built, except for me. I have more than, no, I'm kidding. That's the end of the bones. So I'm going to end this, stop my share, and stop my recording and say night, night, guys.